Good afternoon, everyone. I am so excited to be here. I'm Dr. Leela Morrow, and today I'll be talking to you all about emotional regulation. So a brief background of how I got here, because I think it's important for you all to understand that my journey started out doing my psychology fellowship in pediatric oncology. So many years ago, it's about 13 years that I uh, did my fellowship at the Children's Hospital in Philadelphia, really helping parents go through the support process in helping their child deal with cancer. And then I spent some time on inpatient doing consults, specifically within the eating disorders program. So here again, the wide range of working with young children, adolescents, and really helping parents cope and support and deal with their child with disordered eating. I recently started over in endocrinology last August. So I haven't quite made a year yet, but very similar patient population. The work that I'm doing currently is parental and family coping, adjustment to a new diagnosis, coping with medical conditions, and doing a lot of psychoeducation. Again, the interesting thing about my job as a pediatric psychologist, I'm really not just working with the children in isolation, but working with the entire system. So the entire age range of infants, toddlers, children, adolescents, and adults. So bringing it back, this is kind of like, Psychology 101 today. So emotions and the purpose of emotions are adaptive and they function to give you information. So you see on this graphic here that we know the fight, flight, and freeze, right? And so we know that when we are faced with adversity, we will have one of these three reactions. We might have a combination. And the thing that I want to point out here is that our emotions are grounded biologically in the brain, and then we have these physical symptoms. So in terms of freezing, you might feel numb, your heart might be pounding, you have a sense of dread, so on and so forth. And you can really take a look here that it's there to protect you. It's there as a survival mechanism. So we want to be able to acknowledge our emotions. Also important to note that we have developmental stages. So today I'll be giving you a brief overview of emotions during these key developmental stages. And so hopefully most of your children fit along this. And I just want to point out that you notice that these developmental stages have many different age spans. And the reason for that is because so much happens in infancy. So we have an entire stage for 0 to 2 years. Also to point out that adolescence is such a wider span, 11 years to 22 years, because the brain is developing and the brain continues to develop into the mid-20s. So many of your children might be in adolescence, but adolescence can, there's a lot that's going on during the adolescent age range. So getting back to infancy, for those of you that might have infants here, infants experience early emotions. And so we talk about this in terms of the primary emotions. These are present in humans and other animals. They emerge early in life. So you see that, the little picture of the babies there, joy, sadness, fear, and surprise. Those are what we call the self-conscious emotions, some of those primary emotions that go on. They require a degree of self-awareness, especially consciousness and a sense of me. So when I'm sad, I make a pouty face, I might cry, and that is giving me and building my self-awareness skills. Emotional regulation and coping begins in infancy, and the critical person who helps to regulate that is the parent or caregiver. So infants develop their ability to inhibit or minimize the intensity and duration of emotional reactions. So you probably all have heard about different methods in putting your baby to sleep, like sleep training, the cry it out method. You're going to let your child cry so that the child can learn on their own. And there's really a lot of different theories here, but really my goal today is to be giving you an overview of some of the basic emotional regulation skills that are being developed throughout the lifespan. So as I mentioned, the caregiver's action and context influence emotional regulation. If you let your baby cry, the baby will cry and eventually learn to soothe themselves. That's one theory. The other theory related more with attachment is that you will soothe and console the baby, and then eventually the baby will learn to have a secure attachment to the caregiver and build a sense of trust. Infants with negative temperaments have fewer regulation strategies. So what I mean by this is that if the baby is known to be more fussy than others, they may need to guide and look at their parent for more support to help them regulate. And we know that mothers who are depressed or have a history of depression, in studies, they've shown that they tend to rock and touch their crying infants less. So this is an interesting finding and something to think about. And do those infants then learn to self-soothe better? Or do they adapt faster? Or is that also maybe a risk factor for that infant to maybe develop depression later in life? I think there's a lot of mixed literature here. But again, my goal today is to help you understand that emotion regulation really does begin in infancy. So as I mentioned, crying, and it's really, really interesting. This is, kind of the first way that infants will express emotions, and they're really building their social relationships. So believe it or not, if you can spend time with an infant, you can differentiate what is the basic cry, what is the anger cry, and what is the pain cry. And so the basic cry begins with a rhythmic pattern, usually consisting of the cry, then a brief silence, and then some inspiration whistle that might be higher pitched, a brief rest before the next cry. That is completely normal. You'll notice that the anger cry can have some variation, and there's more accessed air. So you can certainly tell if you're a parent of an infant that something is wrong, they're angry about something, something might be hurting them. And each of these cries have been differentiated in research, but as a parent, you learn to adapt and adjust. And the anger cry can also sort of sound like the pain cry. So a sudden long cry followed by breath holding so that they gasp for air and then they cry again. Smiling. This is a really, really important milestone in terms of the social development. So babies, soon after they're born, they do what's called a reflexive smile. That's basically just the mouth, testing the muscles, and it does not occur in response to any external stimuli, meaning it's not that your baby is smiling back at you, it's very reflexive. The social smile occurs somewhere around 6 weeks of life, and that's in response to an external stimulus. So it's wonderful to watch new parents smile at their children and waiting for them to do this social smile. There's a lot of secondary reinforcement, a lot of praise associated with that. And behaviorally, as you know, the more contact that you can make socially with that infant, the more they're going to respond and smile back. Fear is also a critical emotion. And so in infancy, stranger anxiety typically develops within the second half of the first year. This is, again, something that I talk to parents about as completely normal. This is adaptive and back to evolutionary survival. So you want to be wary of strangers because, through the first half of your year, you are spending time with your immediate parents or caregivers. And so when a stranger comes in, it's very adaptive for that child to become a little frightened. And then, over time, that stranger anxiety goes away. Separation protest is a distressed cry when the caregiver leaves. And this is directly related to attachment and bonding. Again, very appropriate for the infant to do this. Moving on to early childhood. So again, just to remember, we were between the ages of 2 to 6. And so children are really beginning to express their emotions at this point. And pride, shame, embarrassment, guilt are all examples of self-conscious emotions. During these early childhood years, based on parents and caregivers, pride and guilt become more common. So parents are there to provide feedback. You did a great job at cleaning up your toys. So there's a sense of pride. Stop fussing around with your little sister. The child might feel guilty. So this is really influenced by parents' responses to children's behaviors. Here's just an example. Sometimes parents might say these things. You should feel bad about biting your sister, to then elucidate some of those feelings of guilt and then furthering those conversations. Children are also understanding emotions. And so their own internal understanding of emotions is linked to something called pro-social behavior. And so when we think about pro-social behavior, these are things like empathy and having your child begin to understand, if I do something and react in some way, it's going to give me good feedback. Children also begin to understand that the same event can elicit different feelings in different people. And so I might feel proud for using the potty, but for another child who has not mastered potty training, they might feel a little fearful. So children are beginning to understand their world around them. By age 5, most children are showing that they are more able to reflect on emotions and have this idea of growing awareness of the need to manage emotions according to social standards. So they're really looking at their external cues and in looking to you and their caregivers and other peers to say, do I really react like that? Or should I react a different way? And they're able to begin to moderate some of their emotions. They're also regulating their emotions. And so this plays a key role in their ability to manage those demands and conflicts that they face in interacting with others. Now, parents at this stage can be described as taking an emotion coaching approach or an emotion dismissing approach. And a lot of this comes back from how you were raised as a child. And so a lot of the work that I do in helping parents is to be able to validate their child's emotion. We want to learn to become good emotion coaches to then help our children learn to modulate and regulate emotions as they grow older. And this ability to modulate emotions really benefits children in their relationship with peers. So it's okay to say, Johnny, I know you're really scared and it's hard for you to fall asleep tonight. I know some of your friends are also experiencing this thing. Maybe at tomorrow's play date, you guys can talk about what you guys have done to help each other to be able to go to sleep and share some ideas. Children at this stage, 5, 6, can really start learning and talking about some of these. Then moving on to middle and late childhood. So now we're talking about the ages between 6 and 11. We see that there are huge increases in developmental changes. Children are improving their emotional understanding. Children have increased understanding that more than one emotion can be experienced in a particular situation. So the example that I like to give here is that, Sally is out on the soccer field and, she didn't score as many goals as she would have liked, but they won the game. So maybe she might not be feeling as proud of herself. However, she won the game. And so for the team, that's a great success. So she can feel disappointed in herself, but also proud that she won. And they have this ability to be able to manage multiple emotions. They also have increased awareness of the events leading to these emotional reactions. So maybe going into a new school might make me a little anxious, and that's okay. And then when I get there, I can feel better and happier and more pride because my teachers are really there to help me. So that's another example of the major changes that are going on at this stage. During this stage, they have the ability to suppress or conceal negative emotional reactions. So this is really critical when parents are coming to me saying, you know what, I'm not sure that Mikey is, sharing too much with me at this point. And I really reassure parents and say, you know what, it's okay because socially it might not be acceptable to do. So you want to think about different places and spaces for your child to be able to express their emotions. The use of self-initiated strategies for redirecting feelings, this requires a lot of cognitive work. And so, children are also expanding in their cognitive development. So this goes hand in hand of maybe when I walk into a new situation, I might be a little bit timid, I might be a little bit shy, but let me try those skills that my parents told me. Maybe try to find one person who might enjoy the same thing as me. That might be a way that they're able to regulate their emotions. And children at this stage also have a capacity for genuine empathy. Now, they may not be able to express it as much, but it's there. It's there. And by talking about examples and teaching about empathy and kindness to others, you as parents and caregivers can really build this skill in your children. All right, let's move on to adolescence. So adolescence is one of my favorite times of development because so much is happening. And in this slide, I just would like to point out kind of the old model and maybe some of the way that we were raised is that teenage time is a time for stress and conflict. And, there's this idea of storm and stress virtually on a daily basis is that The adolescent is there to rebel against the parents. And the new model is really suggesting that if you're able to build those strong attachments in early childhood, those parents are the core. They are the core, and it's okay to have moderate parent-adolescent conflict. That is really a common place because the child sees you as a stable and safe person. And so we want the child to be able to experience that conflict in the home because then it's going to help that child deal with things as they grow up. And so this new model is much more strength-based and not as pathological. And so I just want to make sure that we're all in agreement that we're thinking about your adolescent with this new model. So adolescents and families, this is a very tricky thing, and some common issues that come up in therapy is how much do I monitor and supervise my adolescent? And I think of the parent here as like the manager. They're supervising their adolescent's choice of social settings, activities, friends, their academic efforts, and they're sort of managing from afar, but really letting that adolescent kind of have some decision making. And when parents engage in positive parenting practices, so this means a lot of labeled praise, they are more likely to disclose information. You know, something like, you did really, really well on that math exam. And so I'm feeling so proud of you. And just leaving it open. And so you give them that positive praise, they may be more likely to then later discuss a social situation with you. It can be tough, but you can get there. Also at this stage, adolescents are really trying to assert their autonomy, but also they want that secure attachment. So parents must weigh these needs for autonomy and control, independence and connection. The push for autonomy may puzzle and anger many parents. Why is my child separating from me? Why don't they want to hang out with me anymore? How come they're not talking to me at dinner? And so we know socially that boys generally are given more independence. And so it's important to be able to open up these kinds of spaces for conversation and really maintain appropriate adult reactions for that child who wants to assert their desire for control, regardless if they're an adolescent female, male, transgender, or whomever. The role of attachment, as I mentioned, securely attached adolescents. So as a child, if they have that secure attachment base and you continue to raise them as being securely attached to you, they are less likely to have emotional difficulties and to engage in problem behaviors, to engage in juvenile delinquency and drug abuse. So really, it's this fine balance between freedom and control. And it's really, really tough to do. It's very hard to master this. So much of it depends on, again, your own parenting that you were given as a child, your views and beliefs as a parent, personality factors and dynamics. So it can get a little complicated. Peers are also a huge source of support in adolescence. And so I'll go through this pretty quickly because I really want to get to the important part of my talk related specifically to your population. But here, friendships, most teens prefer a smaller number of friendships. Friends are becoming increasingly important in meeting social needs. And these developmental advantages occur when adolescents have friends who are socially skilled, supportive, and oriented towards academic achievement. So even if this might not be kind of how your adolescent is, as long as they are able to find somebody who is like that, that can be a real buffer in navigating some difficult peer relationships. There's certainly a lot of peer pressure. So young adolescents conform more to peer standards than children do. And adolescents with low self-esteem and high social anxiety are most likely to conform to peers. We think of cliques and crowds. Also, this is kind of defined here in the social emotional literature as cliques being small groups averaging 5 to 6 individuals, and crowds tend to be larger than cliques and less personal. So the members don't really spend that much time together, and we can all think back maybe to our own high school experiences where we had those certain crowds, and it's more based on reputation. So within our adolescent population, we're really looking at a few close friends. If your child can maintain a few close, strong friendships, that is going to be truly protective to help them get through some of their social emotional processes. All right, so now let's get to Klinefelter and other X and Y variations. I just want to present that some of the research here shows that Klinefelter syndrome and other X and Y variations may increase the risk of anxiety and depression, and also can lead to some social, emotional, and behavior problems, such as low self-esteem, emotional immaturity, and impulsiveness. And I will say with this is that this does not affect everybody. And so it's really important to set up a meeting with a therapist or psychologist that can help really prevent, like do some preventative work around this, do some screening, so that if there are some mild symptoms of anxiety and depression, that child already has some established mental health support to be able to help them through adolescence. Just pointing out some numbers here. So approximately 18% of patients with Klinefelter syndrome suffer from generalized anxiety. And in addition, rates of clinical depression among Klinefelter syndrome range from 19 to 24%. Now, more than 2/3 of Klinefelter syndrome patients reported depressive symptoms. So they might have a few depressive symptoms that may not meet criteria for major depressive disorder. Now, in working with this population myself, it's very important to ask about self-injurious behavior. Clinically, I've been seeing more and more of self-injurious behavior. So this is a way that teens will cope with their emotions. And once they can disclose this to a parent or their therapist, there's really good evidence-based treatment to help them learn other emotional regulation strategies to not hurt themselves. So this is really, really important to screen for. Deficits in social engagement is characteristic of patients with Klinefelter syndrome, including deficits in attention switching. So shifting from one task to the other, staying focused for prolonged periods of time, might have some deficits in imagination, communication, and general social skills. So this would explain why Klinefelter syndrome patients have an increased risk of mental illness in general, and in particular, anxiety and depression. Because that frontal lobe, like I said, does not fully develop until mid-adulthood. And then on top of that, you have these variations genetically. So that might make it even more stressful, which is why I really strongly recommend some more preventive work around mental health. So personality also plays a key role between emotions. And with Klinefelter syndrome, we know that those patients have higher levels of neuroticism, lower levels of extroversion, lower levels of conscientiousness, and openness to experience. Now, I want to bring that back because this is a large personality theory called the Big Five. And the mnemonic that I use and teach with my students is something called OCEAN. So we have openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. So it's important to keep in mind that personality features can also play a role in emotional expression. So the question of whether these personality profiles in our patients are more vulnerable to psychopathology has yet to be addressed. And it's really hard to separate that in psychological research. What makes somebody's personality, because that's more stable, and then genetically they have these variations predisposed to things like anxiety and depression. There's still quite a lot to be studied there. I want to also get to an important study that discussed emotional coping in Klinefelter patients. So this study primarily looked at adults and kind of the ways that they cope. So in terms of expression of emotions, these patients have difficulty regulating their emotions, resulting in emotional outbursts, showing frustration, anger, or letting off steam. They also tend to avoid. So instead of approaching, they will avoid and sort of let things take their course. In my therapy, this certainly plays out when the parents are like, you know, they're just not staying on top of their homework assignments. It's almost like as if they don't care. Well, that's a common feature in, emotional coping. And so some of the work that I would do is helping that child to be able to test ways of approaching things and, dealing with organization and attention management strategies so that they don't resort back to instinctively they want to avoid. Also seeking distraction. So some of the patients that I talk to, because they need that stimulation, they might be going out more, and they might decrease their pressure by smoking, drinking, engaging in substance use. And so that's also something that comes up in my therapy sessions. Passive coping. So they tend to isolate oneself from others. They tend to worry about the past. And so when my patients say that they're worrying about their past, I always screen for depression because that's kind of like the depression profile. And so instead of getting the passive coping, how can I work with your child to be more active at coping and really spending time outside of their room? Certainly this pandemic has brought up all sorts of issues in teens. And so promoting spending time with family and friends. Also seeking social support. So people with Klinefelters tend to ask for help less. And so we really want to help them with seeking social support in times of stress. So here I just like to, kind of summarize, and we can spend hours talking about this topic, but really summarize some of the things that I do when I'm working with adolescents and children to help build their emotional regulation skills. Things that you can do as a parent too. So you want to name that emotion. I am feeling angry, and validating that anger. I hear that you're angry. I see that you're angry. You want to identify and resolve triggers, or instead of triggers, I like to say sometimes those activations. So identify and how do we resolve that? Be mindful of your emotions. So emotions come and go. Emotions are not permanent. Emotions are not forever lasting. It's really hard to believe that when you're feeling so strongly about your emotions, but a lot of the work on mindfulness and awareness of your emotions, that they come and go like waves, can really help you understand that their emotions change. Try the opposite action when your emotion is intense. So if you're really angry, how can you get that out in a very calm way? Maybe you can listen to some music to soothe you. And so this is taken from dialectical behavior therapy, where they try the opposite action, and it tends to bring down or reduce that strong negative emotion. Being grounded, soothing, and distraction. Distraction can do wonders. It's a very important tool that I use in helping parents to help their child be able to regulate their emotion, and also reducing emotional vulnerability by increasing your experience of positive emotions. So if you're feeling really, really sad today, I understand that you're feeling sad, but how can we get you to do something where you can feel better? Could you go out for a run? Could you set up some time with a friend? And so really to counteract that negative emotion. And so finally, I just like to leave you with some of the things that I do in my therapy session. With teens, this works really well, facts versus tricks. And so the facts are, what is the evidence that we have to support this? I feel really angry because I got a bad grade in school today. But my mind is tricking me because I feel like now I'm a failure and now I'll fail the class. And that is your brain tricking you. So I do this exercise with teens in therapy, and you could do this as parents too, writing a column down of facts, and then where is your brain tricking you? The second strategy that I like to use is this water cooler strategy, is that you want to contain your emotions. So if it's, in the morning for 15 minutes a day, we're going to contain all those negative emotions. We're going to let it out, talk about it, and then move on with the rest of our day. That might be a helpful way to deal with some of those strong negative emotions. Another one that you can use right in the moment is that support and distract strategy. So, Johnny, I hear that you're really feeling sad today. I understand that, this might not be such a great day for you. And here's what we can do next. So let's talk about some of the fun things that you can engage in. And that helps to kind of just switch the brain off. So validating the emotion, but distracting. And I do a lot of work in helping parents be their child's coach at doing some of this work. Again, it's really tough, but with therapy, you can certainly get there. And so I'd just like to thank you today. I know I went a little bit over my time, but I really had to give you the basics in emotional regulation to then get to some of the strategies. So I'm really excited to hear more in the Q&A. And if you have any questions that we can't get to today, or any comments that you'd like to share with me, here's my email. Thank you so much.